everyone. Welcome to Lab 1, the axial skeleton. So I trust that you can get this far into Primal Pictures, anatomy.tv. If you have any trouble getting this far, definitely go back to the introduction video for Primal Pictures or to the help and tutorials for Primal Pictures, which is on your Moodle page. So we are going to go into 3D real-time. Now, in your, on Moodle, under Laboratories, actually, when I pull it up and show you, on Moodle, under Laboratories, so we'll scroll down a bit. You see here, Lab Outlines. There's some hidden stuff here because this is the instructor version, but you should see this, Lab Outlines, and if you go in there, there should be an outline for each week of labs. Today's is this one, Lab 1, Axial Skeleton. So when you pull that up, all you get is a list of structures, okay? So we're gonna start at the beginning. The first chunk of structures on that list are part of the vertebral column. So when we go into 3D real time, we want that area, so that's going to be the spine, okay? So I'm going to do a quick walkthrough of each of the structures on your list for this week. But I expect that you will spend a bit more time hiding nearby structures, looking at it from different angles, that kind of a thing, okay? So I'm gonna kind of get you started, and then you can go from there to get as much detail as you feel you need to be confident. Now, as we go through the labs, I will also sometimes give you an example of what a test question might look like. And we'll also make sure that we have some practice questions for you before your first lab test. Okay, so when we first get into Primal Pictures, the spine section, we're looking at something like this. Now, there's a few things you can do here to find all of the structures that are on your list. So first off, we're going to zoom out a little bit so we can see the whole vertebral column. There we go. So you can start by just kind of scanning. So as we're going to see in class, the first 7 vertebrae are the cervical vertebrae. 5, 6, 7, okay. And then beyond that, all the ones attached to ribs are the 12 thoracic vertebrae. And below that are the 5 lumbar vertebrae, okay? Now, in Primal Pictures, you'll notice that the first sacral vertebrae is what's called lumbarized, which means it's actually not a part of the fused sacrum. Now, usually, this can go either way in an actual human. Typically, we see this vertebrae fully fused as part of the sacrum. So just keep that in mind, because when we look at material in lecture, you will notice that it actually is part of the fused sacrum. It's not lumbarized. So we won't put this on a test for you because we know in class we're not talking about lumbarized first sacral vertebrae. We're talking about a fully fused first sacral vertebrae. So you can assume for the purposes of this class that on a testing situation, we will always assume that S1, the first sacral vertebrae, is fused. Okay, and so there's your sacrum, and below that is the coccyx. Okay, now, again, get a lot of views here. We haven't included a lot of specifics about the sacrum and coccyx in the lab. However, in the lecture, you will have to know more details, such as the foramina, the spinous process, things like that. So feel free to come to Primal Pictures for that too, even though they're not specifically on your lab outline. Okay, next in our lab outline are C1, C2, and C7. So what we're gonna do is go right up to the top, and I'll add, because this is our first lab, we'll do a bit more demonstration. If you don't feel like sort of scanning around and finding something, you can also type it up here. And some suggestions will come up. So we can search the atlas, okay, and go down to bones, atlas, first cervical vertebrae. You could also type first cervical vertebrae, and that will work as well, okay? So our first cervical vertebrae, let's get rid of this. Oops, let's get rid of that. And let's zoom out a little bit. Okay, so we're looking at an anterior view right now, and the A up here tells you that, okay, anterior view. And if we kind of zoom around to the back, there's your posterior view. Now I think we should have a look at it on its own. Okay, give it a little tip. So now we have a superior view, okay, S for superior. Whoop. All right, so your anterior is here, posterior is here, and as discussed in class, there is no body to this vertebrae and no spinous process. However, you can see the very broad superior articular processes where the skull will attach, and there's your transverse foramina on either side, okay? All right, let's go back out. The next thing on our list is C2, so we don't have to hunt for it because it's just next. So C2, the second cervical vertebrae, also known as the axis, is right below C1, okay? And the dens is also on your list. Let's get rid of the occipital bone so we can zip in here. Now we have a lot of connective tissue in the way. Let's just get rid of it. There we go. All right, so let's click on our C2 and zoom in a little bit. So if we tip up, there's our C2, okay, with C1 right on top. And you can see there's your bifid spinous process, okay, your transverse foramen on either side. There's the body. And most importantly, you can see the dens. Now, if we get rid of this atlas, there's your dens very, very clearly sticking up there, okay? And if we wanted to label this for a test, oops, we can have the program stick a little pin in it. There we go. Okay, so we could have a little pin stuck right in it and zoom out. Okay, so that could be a test question for you, the dens. However, we also might just have an arrow pointing to it. Okay, this is sort of a weird view. We could have it sort of any view we want, really, but we'll try and make it as clear as possible. Let's, oops, show. And let's bring C1 back on here. There we go. Okay, so maybe we would have kind of this sort of a view and have an arrow pointing. We would get a nice clear view, don't worry. So there's your dens and your C2 axis. Next on your list is C7. So let's just move this guy up a little bit. It's a little slow. We'll zoom out a bit and do it. Okay, so there we go. There's our C7. And as we know from class, this vertebrae is special because it's the very last or the most inferior cervical vertebrae. And even though it has transverse foramina, like the other cervical vertebrae, it does not have a bifid spinous process. So there's you can see the bifid spinous processes of the other cervical vertebrae here, but C7 is not like that, okay? So we call that the vertebra prominens, and because it's prominent, you can feel it sticking out on the back of your neck, okay? So there's your C7. Okay, so now, let's go back to our anterior view and zoom out. And now we get to, you know what, I'm just gonna go back to our original vertebral column, and there we go. And we'll zoom out a bit. Okay, because now on our list, we have a few bony landmarks, okay? So these ones are easiest to just search. So the first one is vertebral body. Oh, nothing's coming up. That's not right. Okay, so what are we getting here? We're getting a few vertebrae. Let's go to a typical lumbar vertebrae. Oh, it's hidden from view. We have to turn it around. There we go. Okay, so if it tells you something is hidden from view, oh, I don't know why it's still hidden from view. Anyways, we will work that out. Anyways, so let's inspect this guy. Okay, so the body of the vertebrae, as you saw in class, I'll just draw it on myself. is going to be, oh, let's do that, is going to be, oh, okay, this area, okay? I'll get better at the drawings, I promise. But it's going to be this area here, okay? Let's erase, and maybe I'll get better at drawings. There we go. Okay, there we go. Now we got it labeled. And let's zoom out a little bit. Okay. Oh, and it specifically likes this view. So on a test then, I will definitely, there we go. So the reason it said that it couldn't see it is because it wants to stick the pin right in the top. Okay, so your body is here at the anterior of the vertebrae. As you're going through, it's helpful to unclick whatever you had labeled before you go to the next thing. Otherwise, you're gonna have pins all over. Okay, next up on the list is spinous process. And we can look at a few different ones. So we can look at let's look at a bifid spinous process first. Okay. So, oh, there we go. All right, so your bifid spinous process, and you can see a few more bifid spinous processes here. And then if we want to see a spinous process on another type of vertebrae, let's see a lumbar. There we have a typical lumbar, okay? And again, let's unlabel these and zoom back out. There we go. And now we can kind of spin around again. Okay, so what's next? Transverse process. And sorry, this is a very good time to point out because clearly I had forgotten. That if you have one of these side things open, some of them, like the drawing tool, if it's open, you can't just grab the structure and move it, so you have to close that first. Okay, transverse process, let's see one. Let's see a nice, let's start with lumbar. So transverse processes, as we know, are going to be different depending which kind of vertebrae we're looking at. So there's your lumbar transverse process. Let's look at a cervical one. And we have to zoom out to go up to it. Okay, so there it is up here. And inspect. Okay, so there's our transverse processes on the cervical vertebrae, and we know that these are unique because they have holes in them. So these are your transverse foramina, okay? And let's go home, and let's look at a thoracic one, okay? Now, as we know, a thoracic vertebrae will have costal facets, which are tough to see in primal pictures. That's why it's not a labeled structure for you. But it just means that it kind of has these flat surfaces where the ribs are going to attach, and the other transverse processes don't have that. Okay. All right, what's next on our list? Superior and inferior articular processes. Okay, let's just pick one. So superior articular process. So if we look here, we are looking at the second and first lumbar vertebrae. So what we have is, here's your superior articular facet of L2, and it's forming a joint with the inferior articular facet of L1, okay? And then over here we have the same thing. Superior articular, process. You can call them a superior articular facet as well. This program calls them processes, okay? So specifically, if you can get the pin like on the inside, it'll say facet, but the whole region is the process. So superior articular process, and that will form a joint with the inferior articular process, okay? And again, only because we can't get the pins on the inside there. Next is vertebral foramen, and this is the last bony landmark. There we go. let's just look right in the top. This is the last of our vertebral column landmarks. So your vertebral foramen is going to be, sorry, let's get rid of this bone. And we'll do a little tip. And again, get rid of the connective tissue. There we go. Okay, so your vertebral foramen is the big hole right in the middle of each of your vertebrae. Okay. All right, so we are moving on to the skull now. And what we actually have to do is go back to the original Primal Pictures page and open the next section you want. You can't just jump back and forth between them. You'll notice there is a whole body option. However, that doesn't have as much detail as the separate little ones. So I definitely recommend going back each time and opening the separate body region that you need. Okay, so you'll notice from your lab outline that we don't have any specific landmarks on the skull. We only have some skull bones, okay? So again, you can search them up here. I'm just gonna start pointing to things for you. So frontal bone, mandible, okay. Occipital bone is in the back. Let's get rid of connective tissue. There we go. And let's get rid of ligaments. That's easier. Okay, there's your occipital bone. If we give it a little tip, you can see the foramen magnum in the bottom there, which is how the spinal cord will go down into the vertebral column. Sphenoid is next on my list. This one is fairly interior, but what you can do first is find it. So you can see that you can get quite a good view of it through the orbits, but you can also see a little bit from a lateral view. However, I highly encourage you to inspect this one individually. Okay, so there's your anterior view. Remember to use the little box up here to remind you what your view is. If we tip it, now we're looking at the top, okay? And when we get to talking about things like cranial nerves and the brain, we're gonna come back to this view. So that's not going to be until the second half of the course, but we will get to those things a little later. So we'll be looking at that view. For now, all you have to do is be able to recognize the bone. Okay, next one is vomer, okay? Vomer is located here, so it divides your nasal cavity in two. And let's get a little look at that guy by itself. So it's just a really thin sort of band of bone. And this is a good one for examining because then you can see how it fits in with the other bones. Okay, so that's your vomer. We're not going to give you a vomer all by itself because it's kind of a nondescript entity. We would be sure to give it to you in this view or in this view. Okay, we're not going to give you something super tricky that's like impossible to identify. It'll be in context. What's next? Zygomatic is next. Okay, so you have one on the right and one on the left, and that's going to form your cheekbone. Now you'll notice the zygomatic arch, which goes across here, is not entirely formed by the zygomatic bone. The posterior aspect is actually formed by the temporal bone. And while we're here, let's do temporal bone. Okay, so there's your temporal bone. There are a number of structures on here that we will discuss in class that are not necessarily on the lab outline, and that's going to be things like the styloid process and the mastoid process, okay? But those are not on your lab list. Here's your parietal bone. There's one on the right and one on the left, okay? And those are right at the top of the skull, and they run quite posterior as well and join with the occipital bone. Let's see, what have I missed? Maxilla and nasal. Okay, so your nasal bones are here. There's two of them, okay, and they're very tiny. So you'll see that if we do the examine, they're really just that little bit that you can see. They don't go further into the skull, okay? And then your maxilla is here. Again, there's two, and those are going to form the upper part of your oral cavity. Okay, next on our list, we are moving into the thorax. Okay, so first up, we have all the aspects of the sternum. So manubrium, body of the sternum, and xiphoid process. Please be sure that you write body of sternum in an answer on a test. If you just write body, that doesn't mean anything. You could mean the body of a vertebrae. Okay, so make sure you're specific. Manubrium on its own is fine. You don't have to say manubrium of sternum. There's only one manubrium. Same goes for xiphoid process. However, if you're uncertain, you can always write the whole thing. And that would be fine too. Okay, and then we have ribs and clavicles. So you don't have to identify rib 1, rib 2, rib 3 necessarily. However, for the purposes of the lecture, you certainly should be able to tell us which is which. And that's just through counting, okay? So rib 1, 2, 3, et cetera, et cetera, et cetera. Okay, so 12 pairs of ribs. You should be able to tell us that 11 and 12 are the floating ribs. Again, that's for lecture, not lab. And then you can see here, in class, we will discuss the difference between false and true ribs. So for example, if we look at rib 5, you can see that the costal cartilage connects it directly to the sternum. But if we look down here, let's say rib 9, okay, the costal cartilage for rib 9 connects to the 8th costal cartilage, which comes up to the 7th costal cartilage, and then that connects to the sternum, okay? So the lower ribs, 8, 9, 10, are going to be false ribs because their cartilage doesn't connect directly to the sternum. And last on our list for the thorax are the clavicles, okay? So clavicle 1, clavicle 2, and again, this is just a recognition item for you, so that's probably sufficient for now. Now we're going to move into a couple of items on the scapula. So your scapula is here, okay, right and left. So let's have a look. So posterior scapula is here, okay? So when you're looking at a posterior scapula, you should be able to identify this by itself, okay? So this is your anterior scapula, and you know it's anterior because it's completely smooth. Versus when we spin around to the back, we have this huge ledge. This is called the spine of the scapula, okay? And the spine of the scapula is running all the way across the posterior of the scapula and ending right here on the acromion. And I'm gonna get that labeled for you. Okay, so we'll get a little pin in there for you, okay? And zoom out a bit. All right, so this is your right scapula. Okay, so spine of the scapula is along here, and then the acromion is this area on top. And you can feel the acromion on top of your shoulder. It's a big bump, okay? All right, we have 2 more structures I want to locate for you here. Whoop, here we go. One is the coracoid process. So we'll uncheck this and put the coracoid on. Okay. And again, let's zoom out a bit so we can get a better look. There we go. Okay, so this is your anterior view. Okay, so your right upper limb will attach here. So your shoulder joint is going to be here. So the coracoid process is right in front of that. So it's anterior to the glenohumeral or shoulder joint, okay? You can't really feel this one. If you really want to feel it, you can find your clavicle and move out towards the shoulder to an area about 2/3 of the way out on the clavicle, just inferior, so just beneath the clavicle, there's like a sort of squashy area. If you push your finger really hard into that area, the coracoid process is in there. It doesn't feel great, so I don't highly recommend it or anything. But in case you're looking for it, that's where it is. Okay, last on our list, let's unclick that, is the glenoid fossa. Nope. Okay. glenoid fossa, oops, get rid of that and that, okay. And let's zoom out. So this is where the upper limb is going to attach to the scapula, okay? So your humerus, the head of your humerus is going to attach here to the glenoid fossa, okay? Okay, that's everything on our lab list for this week. Again, I highly encourage you to get a really good look at these structures, both in context, so like this, okay? So you can see your glenoid fossa there and your humeral head attaching. And inspect them on their own, okay, within reason. So as I mentioned, something like the vomer, which is tricky to identify all by itself, we'll make sure that we keep that one in context for questions, but anything on the scapula should be easy to identify with the scapula all by itself. So make sure you get a good view of everything and post any questions you have in the discussion forum on Moodle.